Fibromyalgia. Listen, if you or a loved one has fibromyalgia, listen up. There are 12 trigger points that you're probably going to want to release. Hi, if you're new to this channel, I'm Dr. K, or Dr. Kareem Samori, and I'm here to help you completely optimize your health so you can reach your full genetic potential. When it comes to fibromyalgia, this is what's referred to in medicine as a garbage can diagnosis, which kind of stinks if you're the patient that receives this, because it means that they've ruled out other diagnoses and they've labeled you with this one. Well, even if you don't have fibromyalgia, you may have sensitivity in these trigger points, and by releasing them, you may experience great relief all over your body. Let's get right into it. We'll be talking about 3 examples in today's video, and then I'm going to go ahead and give you all of the releases. So make sure you stay tuned to the end of this video. Okay, the very first one is suboccipital. At the bony prominence, the part that sticks out in the back of your head, that's your occiput. So suboccipital is just below that. There's a ligament called ligamentum nuchae, and it runs from there down to the base of your neck at C7T1, so the bottom of your cervical vertebrae and the beginning of thoracic. This particular ligament is a neurological inhibitor for your entire body, which means by releasing this first, you can create inhibition or a relaxation effect for the entire body to create an unwinding, and that unwinding can give you fascial slack and relieve a lot of pent-up tension or pain that you might be experiencing. The second release we're going to be talking about is the rotator cuff release. Now, the rotator cuff release should properly be done by placing pressure right where the rotator cuff tendons come together. Oftentimes what happens is the fascia wants to bind together, and then all it takes is a small postural deviation, like a little bit of forward shoulder, forward head, or tipped up chin, to suddenly make the supraspinatus, your first rotator cuff muscle, have to work all day long to pull the head of the humerus of your upper arm bone back into your shoulder blade. As opposed to, if your posture is right, it sits without any muscular effort at all. Now, for many of us, working at computers or desks or what have you, our posture ends up deviating a little bit forward. And if that's the case, every time this one muscle contracts, the other 3 rotator cuff muscles are going to have to contract if it's bound right there, because all the tendons are linked together, right? And a tendon's just what links a muscle to a bone, right? So it's the intersection. It's that part that transitions from muscle to bone. And so if every part of that's contracting every single time, it's not that well vascularized, it doesn't have great blood supply, it's likely to get tender and create tendonitis over time. The third release I want to talk to you about is the femoral triangle. Now, your femoral triangle is great for a whole leg release, so a whole lower extremity release, especially if you feel sensitivity on one side compared to the other. You might be wondering where this is. If you come up from your kneecap about 2 to 4 inches, depending on the person's size, girth, and musculature, you might find a sensitive region on the inside of your leg. If it is sensitive, this is an area to release. It's where muscles come together in a triangular fashion, and fascia holds them together, especially if it binds or you get tight. By releasing here, you can get a full lower extremity release and experience true relief. It's absolutely amazing. Okay, so you might be wondering about the other 9 releases. Please go to nubbyreleases.com. They're free for you today. I'd love for you to enjoy them. Please go to nubbyreleases.com. I hope you have a beautiful day. God bless you. I love you. Thank you.